Welcome to today's press briefing. We have on the stage two doctors with us, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Gladys Guan, Chief Manager of Hospital Authority. They will report on the COVID cases and X-ray situation. Dr. Guan, good afternoon. At present, there are 1,604 confirmed cases in our hospital system, 220 of whom are new cases. And for those requiring isolation, 441 patients are now in isolation wards, 74 patients in second-tier wards, and 497 patients in North Lantau Hospital, Hong Kong Infection Control Center, 180 of whom are new patients. We also reported 8 more patients in critical condition and 8 more patients in serious condition as of yesterday. Among the inpatients, 32 are in critical condition and 25 are in serious condition, and 11 patients in critical condition are receiving intensive care. And today, the Tuen Mun Hospital just reported 1 child in critical condition, who is a girl aged 5 years and 9 months without vaccination record. Because of persistent fever and coughs, she was admitted to A&E department, and she was sent to children's ICU unit. And we appeal to parents not to hesitate, and they should send their children to get vaccinated as soon as possible. COVID jabs remains the most effective guard against cases in severe cases and death cases. And now children between 6 months and 3 years old are eligible for jabs, and we have 50 GOPCs providing the service. Starting next Monday, 15th of August, parents can make a booking appointment online for Sinovac jabs. And we also reported 3 patients passing away. They were 3 female patients aged 85 to 91. They were not residential care home residents. One of the deceased did not have any COVID jab. One had 2 jabs and one had 4 jabs. The first deceased patient was a 91-year-old female patient. She had some kidney problems, and on the 18th of July, because of coughs and poor appetite, she felt unwell, but according to record, we did not find any medical consultation record. Her residential building was subject to compulsory testing on the 24th of July, so she had a test. The CT value was 24.7. The patient was then admitted to our hospital, and during her stay, she was prescribed antiviral oral drugs. Her condition became stable afterwards, and she also obtained 2 consecutive RAT negative results. She was eligible to be discharged. So on the 31st of July, she was discharged from hospital. And then about 2 weeks later, on the 12th of August, her family found her unconscious at home, and on arrival at the A&E unit, she had been unconscious, and because of the unknown death cause, the case has been referred to a coroner's court. The second patient, 85-year-old female patient without vaccination record, she had a stroke, and she also had Parkinson's disease. On the 24th of July, she tested positive on her own initiative. So on the 25th of July, she visited a private doctor who prescribed to the patient some antiviral oral drugs. And on the 26th of July, because of fatigue, she consulted our facility. And then she was admitted, and the test results had remained positive. On the 11th of August, her breathing situation became worse, and she had to rely on breathing support. We also prescribed antibiotics to her, and yesterday, because of her lung condition, she passed away. The final deceased patient, an 85-year-old female patient, she had DM, hypertension, and hyperlipidity, and on the 24th of July, she tested positive, and as we understand, she did not make a report to us. And on the 28th of July, because of poor appetite and a sore throat, she came to our A&E unit, and on arrival, we found her to have low blood sugar level, arrhythmia, and also lowered blood oxygen level, as well as shortness of breath. And she was taken by the hospital to the inpatient ward, and she was found to have a heart disease, and her condition was not satisfactory. She remained to rely on high oxygen support. She passed away yesterday, and from these 3 cases, we can conclude that for elderly patients and other patients who test positive for COVID, they should make a report to us. And sometimes they may not be aware of their symptoms, and at times these symptoms may be very mild. It could be a sore throat, fatigue, poor appetite, and these could be the onset symptoms. Because from the experience of handling severe cases, we understand that they usually started with these milder symptoms. So for patients who feel unwell, please approach us as quickly as possible for an assessment. As said just now, if found to be suitable, patients will be prescribed with antiviral oral drugs to treat COVID. For patients who have yet to complete the vaccination regime, our colleagues would still conduct clinical assessment. That is to weigh her condition against contraindications and also possible side effects, and the clinicians will discuss with patients on the relevant conditions. So we appeal to everybody to get help as quickly as possible and to get jabbed as quickly as possible as well. As of yesterday, 178 patients recovered, including 144 who have been discharged, and 10 more patients have been found to be positive via admission, screening, or examination, and 15 patients sharing the same ward have been listed as close contacts. As for HA staffers, we have 53 more staff members infected with COVID, and 24 colleagues have returned to their positions. And that concludes my report today. I'll give the floor to Dr. Zhang. Good afternoon. We recorded 5,148 local positive cases, including 1,839 PCR positive cases and 3,309 RAT positive cases confirmed via PCR. We also recorded 160 imported cases, including 132 PCR positive cases and 28 RAT positive cases. As reported by Dr. Kwan, we have recorded 3 deaths, and the total death count since the 5th wave now stands at 9,349. Among the 160 imported cases, 26 have been picked up at the airport, and 95 were picked up in quarantine facilities within 7 days, and 39 cases have been picked up after they've left the facilities after 7 days, and most of these cases have high CT values. They should be repositive cases. We have 2 RCHEs and 1 RCHD having cases. Sa Tau Gok nursing home, 1 resident infected with 8 residents and 2 staff members subject to quarantine. Alice Ho Miu Ling Nathan So nursing home. Starting from the 9th of August till now, 3 staff members and 1 resident have tested positive. 3 residents and 1 staff member will be quarantined. Hong Yan Yun, 2nd in Tuen Mun, 2 residents infected and 10 other residents to be quarantined. Saturday is not a school day. We have not advised any schools to suspend in-class teaching. As for subvariants, for suspected BA.4.5 cases, the numbers have climbed And at the moment, the percentage is 18.9%. For suspected BA.2.12.1, the percentage is 8.1%. So once again, I call on those who haven't been jabbed to get jabbed as quickly as possible, because vaccination remains effective against BA.4.5 cases in terms of severe cases and death cases.
It's now time for questions. Please identify the organization you represent. The one on the right, please. Doctors Cable News. The 5-year-old kid. Any family member infected? His condition deteriorated rapidly. Any encephalitis case? And also the deceased person with 4 shots, who was she? Secretary Lu Chongmao said that the number of cases has gone up. This is affecting the public hospital. What disciplines are more affected than others, and what measures do you have in mind? For the 5-year-old case, our understanding is that the family members were not tested positive as to whether there is any encephalitis. There are still tests going on. We don't have any definitive answer there. The 91-year-old female had 4 shots of vaccines. Now, the number of positive cases has increased. Will the number of beds be sufficient to admit patients? Now, we are putting in place the contingency arrangement regarding the hospital beds. So we will keep an eye on the development of the COVID situation. And we do have the system whereby we deploy the beds according to the demand. As to the services, we don't have any particular discipline or any particular area which will be subject to changes. But as the number of positive cases is creeping up, quite inevitably some non-urgent surgeries or non-urgent tests or examination will be adjusted, and we are keeping an eye on the situation now. Next, please. The one on the left, please.
News. The first question about the 5-year-old girl in critical condition. Could you tell us what are the possible reasons for her quick deterioration? Does she have any underlying diseases, and what is the virus? What is the subvariant that she is contracted with? And another question about the 91-year-old lady who got 4 doses that passed away yesterday. Could you tell us, when she was admitted to the A&E, was she tested positive for the virus, or does she still carry the virus when she passed away? Thank you.
So for the 5-year-old girl, and we suspect that her rapid deterioration probably could due to the COVID, whether it is causing the encephalitis or other conditions, we are still doing the investigation. So at this point, it's quite difficult for us to draw a conclusion, but we believe there's a chances that because previously there is a similar cases where the child didn't have any vaccination, but when they have COVID, they are more susceptible to some central nervous system inflammation or causing the encephalitis. And we don't have the subvariant yet because the patient was just admitted last night. And for the deceased who received the 4 doses, we don't have the result because when she arrived in the A&E, she already passed away. So we already referred the case to the coroner. So probably at the coroner or the forensic pathologist in the Department of Health, they may carry out the subsequent investigation to see whether after 2 weeks of discharge, whether she's still carrying the virus.
Next, please. The one on the right in front, please. Your organization, please. Now TV. We received a request for help, a 38-week pregnant woman on the 3rd of August. She came back to Hong Kong after quarantine period. The color code was okay, but she had P-cell on the 9th. She was okay, and then on 12th of August, her Leave Home Safe app turned into red now, and she is in a critical condition about the baby, and it is likely she might be subject to cesarean section. She's worried about going out because she has been issued with a red-colored health code, and she has tested negative, but she is still issued with a red code. Is there any confusion there? Also, that this pregnant woman has an urgent need. Will she be allowed to go and seek medical attention? Today, the number has breached 5,000. Dr. Chuang, are you worried about the number of cases creeping further up, and when is going to see the peak, and when it's going to be leveling out? Right, if one has been issued with a red color code, and you talked about her test result being indeterminate. Now, with an indeterminate result, the test was conducted at the private lab, and the results would be sent to the CHP. If it is a positive case, then one would be issued with a red health code, meaning that it is a positive case. The person may be tested again, testing negative, but since there was a positive result, this was a positive case. This could have been a re-positive case coming back from overseas. We do have cases like this in which this is a re-positive case. If it is a re-positive case, we will deal with this separately. My understanding is if someone is in isolation and if one has medical needs, or one suffers from a fall and needs hospital treatment, then one can go to the hospital. And this can be dealt with like this. And one can call 999 if there is such a medical need. What's the next question? Right, the numbers. If you look at the numbers, the numbers are fluctuating, but in general, we do not see any decline. A month or so ago, the number stood at 2,000 or so. Now it is 5,000. The number is trending up, although it wasn't happening within a short space of time. But I think we have to monitor the situation. The situation is on the rise. For those who are not vaccinated, they should go get vaccinated, and they should observe the protocol, like the yellow health code, the wristband, and so on. If one feels unwell, one has to go get tested and seek medical attention and make the declaration. The gentleman over there. Dr. Chuang, TVB. My first question is that the number has breached 5,000, BA.4, BA.5. It seems that the case is really rising. Are you worried that this becomes a prevalent strain? That is for the HA, the five-year-old girl. Did she suffer from an underlying condition?
According to World Health Organization and overseas experience, BA.5 could become the mainstream subvariant of many places, and Hong Kong is no exception. We've also noticed that the BA.5 cases have increased in number and percentage, and the number of and the transmissibility of this subvariant is higher than others. So if you feel unwell, you should see a doctor as quickly as possible and get tested. For the 5-year-old girl, she did not have any particular underlying condition. She was healthy. Next question, this lady in front. I'm from Ming Pao. Good afternoon. About the death cases today, you talked about two 85-year-old female patients who had deceased. Now, first of all, for the deceased who had had a stroke after being admitted to public hospital, was she given any antiviral oral drugs? The other patient had diabetes. Again, was she given antiviral oral drugs? Second question, and about a case 2 days ago, one elderly patient died. She sought help because of coughs. She was an 85-year-old female patient, but the HA did not give her any antiviral oral drug. She was only treated with coughs. And also, what about the positive cases picked up in quarantine hotels? You referred to the two deceased who were both 85-year-old female patients, and after they had been admitted to hospital, we prescribed antiviral oral drugs. And you also referred to the case mentioned 2 days ago. At the time, we talked to the patient and did not find any special symptoms. But we're also aware of the fact that sometimes elderly patients might not be very much aware of their own symptoms and conditions. So despite not displaying apparent symptoms, we may find some patients having higher risk. For example, those with chronic illnesses and those who haven't completed the vaccination regime. We would determine the treatment on a case-by-case basis, and in some cases, antiviral oral drugs may be prescribed because of the benefits. So we will go through each and every case in deciding whether the prescription should be given. But as a normal rule, if the patient is deemed suitable, drugs will be administered. The speaker is not coming through. If my memory serves me right, during the first 2 days, when we talked to the patient, she did not report any symptoms to our colleagues. Between the 4th and the 7th day, well, in fact, the 29 cases have been picked up in the quarantine facilities on the 4th to 7th day of the on finding stay. For positive cases, the percentage is roughly 20%. Any other questions? This gentleman on the right. Good afternoon. I'm from Hong Kong 01. About number of cases concerning toddlers below the age of 3 and the hospitalization, and whether the increase in the number of cases have anything to do with subvariants. Regarding the figures we reported just now, for toddlers below the age of 3, 19 required hospitalization. I need to check again. A few days ago, when I last checked, the number of confirmed cases concerning children did not rise particularly, but I need to check again relating to cases below the age of 3. That's the end of the press briefing. Thank you.